Good afternoon. Welcome to Genomics Gupshup, episode number 58. Genomics Gupshup is an initiative by Mapmygenome to create a vibrant community around genomics and make this fascinating science available to everybody. We bring to you conversations from medicine, from nutrition, from genetic counseling, and many others that help us to understand how DNA helps us in our day-to-day lives. We are now available on your favorite podcast platforms, including, of course, YouTube, Spotify, Google Podcast, Apple, and so on. So do tune in and go back and look at some of the previous episodes that we've had as well. Today we are delighted to welcome Dr. Raghuram Kondala. He is a leading gastroenterologist and a very well-respected expert in digestive health. He is known for his clinical precision and empathetic patient care. He has been at the forefront of treating complex GI disorders, including liver diseases, IBS, and gut-related infections. From busting common gut health myths to navigating cutting-edge diagnostics and lifestyle modifications, he brings both wisdom and warmth to the conversation. In today's episode, we delve deep into the gut, figuratively and biologically, and we pack everything from microbiome insights, pharmacogenomics to H. pylori and corporate health trends. Welcome to Genomics Gupshup, Dr. Raghuram. I'm so glad you are able to find time for us from your busy day.
Thank you for having me here.
So Dr. Raghuram, we'll start with what inspired you to become a gastroenterologist.
So, from childhood, my tendency has always been to look for anything which is pretty diverse. So, among all these specialties, I realized that gastroenterology has a lot of diversity to it. There is a whole subspecialty of liver and related problems. Then we have pancreatic disorders and the luminal gastroenterology, something which addresses problems like acid peptic diseases, diarrhea related problems, and inflammatory bowel diseases. So there are n number of conditions which are treated by gastroenterologists, and this diversity attracted me towards this field. And yeah, that's the reason why I primarily chose gastroenterology as my specialization.
So where did you study medicine? Is it in
I've graduated from Usmania Medical College,
which is one of the leading colleges in Hyderabad.
So I've joined Usmania Medical College in the year 2000. Then I did my MD in internal medicine from PGI Chandigarh, which is again considered one of the premier institutes in India. And between 2011 to 14, I did my DM in medical gastroenterology from GB Pant Hospital, which is situated in New Delhi, and it is associated with Maulana Azad Medical College and related hospitals.
That's wonderful. And now you are at Continental, I think, also.
Yeah. So I've been practicing as a gastroenterologist for the past 10 years in Hyderabad, and have been associated with Continental for the past 6 years.
And I think Continental also started by a gastroenterologist also.
Yeah.
So there is.
So our chairman, Dr. Guru Reddy, is a gastroenterologist himself. So he is practicing gastroenterology both in the US and India, and so he's our lead and the one who guides us in all our endeavors.
It's amazing. And so I'm sure you get a lot. I mean, everybody has gut issues, right? And today I think the gut is not just gut issues, but there are also issues that are tied to many other things. So the kind of people that come to you, I think, must be very varied kind, right? So
Yeah.
how does on a typical day, how does your day go? Like, do you get a lot of people, everybody having different issues? Is it similar issues? How does that work?
So our typical day starts with the endoscopic procedures. So because most of the procedures will be done under anesthesia, they need to be in a fasting state. So we start our day with the endoscopic procedures. Once we are done with that, then we do a quick ward rounds of all the inpatients. Then starts the outpatient section where we start seeing patients with various issues. Coming to the GI issues that we see on a very common basis, most often these are dyspepsia, which means that SDT and gas related issues. Then we also tend to see liver related issues, and of late we are seeing that fatty liver and related problems have become a very, very common problem. So usually it's dyspepsia and fatty liver related conditions, and also other conditions like pancreatic disorders or advanced liver problems like cirrhosis occasionally.
So recently, I think there was an article that said 80% of Hyderabad tech employees had fatty liver, which is quite fascinating, right? Because I'm sure that it's, I know that fatty liver is potentially caused by some genetic variants, but clearly there must be lifestyle, because it can't be 80% is too high a number if you just look at it from a genetic predisposition kind of thing, right? So is it, is it the lifestyle, is it the night shifts, or is it stress, or a combination of all of them?
The percentage is certainly alarming, I need to agree on that. So the prevalence rates have varied between 30 to going up to 80 to 90% in people who have diabetes. So they have one cohort where the fatty liver rates are very, very high. And we need to broadly divide fatty liver into two situations. One where regular alcohol intake is there and related fatty liver condition. The other thing is non-alcoholic fatty liver disease, which is associated with diabetes, and overweight or obesity is another common reason why we see fatty liver. And so, what's the role of genes in that? There are certain genes like PNPLA3 which have been shown to be associated with fatty liver disease, and there are other variants like lean NASH where your BMI may be within the normal range, but you can still have fatty liver. So there the genetic things tend to play a major role. Diet has a very, very important role to play in fatty liver. So intake of high calorie foods, and we need to look at things from a calorie perspective. The human body needs around 1800 to 2000 kilocalories in a day, and if you are taking more than those calories on a very regular basis, the extra calories are converted by the body into fat, and it tends to get deposited at various places. Liver is one such storage organ, and there you tend to see the fat getting deposited, leading to fatty liver. The flip side of this is the fat over a period of time can lead to liver damage. In fact, now we see that this is the most common challenging cause of cirrhosis, and remaining conditions can be certainly addressed, but with fatty liver it's more about emphasis on weight reduction, diet control, lifestyle measures.
And I think people find that it's a hard thing for people to realize that lifestyle is actually one of the big reasons. They all want to pop a pill and hopefully get to that point where.
So that's something that we tend to develop over a period of years, and it's hard to get rid of the bad habits. So that's where the issue lies.
Yeah, I think that's one of the things people have to realize, that it's about building habits that you can last for a long time instead of doing one specific diet and getting frustrated with it.
Which help you in living longer, right?
Absolutely.
So it's said that, see, you can have 100 problems, but once you have a health problem, there's only one problem that you're facing.
It's a good one. I like that, yeah.
And there are only two precious things. One is health, the other is time. Okay, so maintain your health so that it can give you more time. So that this would be the focus whenever we want to look at things in a proper perspective.
Absolutely. So I think in India we have kind of normalized this whole gastric problems, right? Like there are movies like Piku and others that sort of it's sort of looked upon as something that as you grow older you will have issues. I mean the way they showed in the movie, and even I remember when my dad was alive, I think talking about gut issues was a thing, a conversation, right?
Yeah.
And today I think there are more than 25 million cases in India that are registered with digestive issues. And I'm sure that there are probably many more that are not in the registry. Right? So I think you mentioned that you typically see people with gastric
Acid peptic disorders.
and others.
Yeah.
How often do you also see things which are infectious in nature, like H. pylori or E. coli or others?
So, when we talk about the acid peptic disorders, we need to understand that the root cause tends to be H. pylori in majority of the situations. Diet, it is assumed that diet tends to play a major role in the acid peptic disorders, but we need to understand that they tend to have an additive role. The primary reason why someone develops the acid peptic disorder is H. pylori. And there is another entity called as GERD or acid reflux disease. So what happens is the acid which is being produced in the stomach tends to come up into the food pipe, and related acid damage causes chest discomfort, heartburn, and some people also tend to experience throat discomfort.
Oh, throat discomfort is also
Yes.
very, very, very interesting, right? Like, luckily, I have not had too many gut issues. At least so far.
Yeah.
And I think maybe because of just generally eating a little bit healthy.
Yes.
In most cases. And finally, I think I was able to get my daughter to read about a lot about the microbiome and all that. And I think in her case, she went from a diet which used to be very pasta and all the wrong things which I kept telling her not to. But I think when self-realization came, I think
Yes.
then they can, if they fix it and if they are young enough, I think then that becomes a habit. So I think that's the challenge. How do we get people to understand that these are fixable problems, right?
Yes.
And not something that you wait till it becomes so bad that you then go to a gastroenterologist at a point where they don't have a choice but to
treat you with medications.
So, what are the typical kinds of things, like when people come in, what are the kind of tests? You mentioned endoscopy was one of the first thing you start with. But other than endoscopy, are there other tests that are typically done? I know that biofile, like one of them was the infection disease.
Yes.
But there are, do you also typically see genetics or microbiome or any of those kind of tests?
So, not everyone needs an endoscopy. Most of the times, a simple ultrasound scan of the abdomen tends to give us a lot of information, and simple blood tests like complete blood picture also give us a good idea. When we are dealing with conditions like infectious diarrhea, where the assumption is that infection of the intestines has led to the situation, we go for stool investigations like culture sensitivity. Biofile is a very good test, which is PCR based and helps in looking at all the common pathogens which affect the digestive system. So, but yeah, in most of the situations, a well-performed ultrasound scan of the abdomen tends to give us a good amount of information. Endoscopy is done, but it's not as common as assumed.
I think one of the things I really liked when I came to Continental was the detailed history that the team took before even the final consultation. What is the importance of taking that detailed history when it comes to gastric issues? Because I feel that is where the secret sauce is, right? Like you start to understand all the possible issues that are there and come to the root cause, right? So I found that very really, really nice, because it was sort of in my case. But I'm saying that why is that the protocol over a period of time? Is that common for everyone, or is it something that you see primarily in places like continental?
We live in the era of artificial intelligence, so we tend to assume that we can simplify things. But at the end of the day, we need to realize that the science of medicine is an art, okay? And no amount of investigations can substitute for a good and detailed history taking. Over and above that, we also tend to examine the patients. So the amount of information that we get out of the history taking is what makes us understand the problem that the patient is suffering from, and it also tends to guide us what investigations do we need to do. Or in some situations when the history is so forthright and informative, we can diagnose the condition even without any need for further investigation. So, yeah, like I said, at the end of the day, medicine is an art, and history taking is a very important part of medicine. Having realized that, we have made history taking as a very important aspect of our treatment, and I'm sure this is a usual process with any doctor who realizes the art of the importance of practicing medicine in a proper manner.
But I think unfortunately it doesn't happen all the time because of the number of
Yeah.
So nowadays, I think when you look at especially the gut microbiome has gained a lot of a lot of people are talking about it. And the interesting thing that I'm reading pretty much, since we recently acquired Microbiome Insights, which is a company in Canada, is that pretty much everything seems to be connected to the gut, right? Like we know about the gut-brain axis, we know the gut-heart axis. So basically, I think it seems like you're controlling all of health in the gut. What are your thoughts on the gut microbiome?
So, conventional wisdom says that any microbe is harmful, but this science is rapidly evolving, and we have realized that not all microbes are harmful. So, intestine is full of billions and billions of bacteria, which are considered as good bacteria. They are called as commensals. So, what they are doing is there is a tussle going on between the bad germs which enter our digestive system through various routes, commonly through food and water. And the good bacteria that are there in your digestive system, they are countering these bad ones, and they also tend to release good amount of chemicals, neurotransmitters like serotonin. And serotonin is the mood hormone. Serotonin and other hormones like GABA, dopamine, these are the mood hormones, and that's the reason the gut has aptly been called as the second brain. And almost 90% of the serotonin which is there in your body comes from the digestive system. And how does this digestive system interact with your brain? There is a thing called as gut-brain axis. So the vagus nerve, which comes from the brain, is a bidirectional thing.
And it's a huge nerve, right? Like
Yes. So the information from the digestive system is conveyed via these chemicals through the vagus nerve to the brain, and the brain tends to send corrective signals to the digestive system, and this forms the whole crux of thing. And of late, we have realized that gut microbiome tends to play a important role in many health conditions like obesity. So it has been seen that mice which are overweight, if the bacteria which are there in the intestines of these mice are transplanted into a very lean or a thin mice, then these thin mice have started developing obesity. So that's how important the gut microbiome. Yes. So the gut microbiome has been linked to various conditions like diabetes, then fatty liver disease, Alzheimer's. And the science is rapidly evolving in this aspect.
Yeah, I think one other aspect which is, I mean, maybe if you can tell us about the short chain fatty acids that is also produced in the gut as well, right? And how that.
Yeah. So I'll introduce you to certain terms. There's a thing called as prebiotic. Prebiotic is a raw material.
That's a good point. Yeah. What is pre,
Yeah.
post, and multiple
And
biotics?
probiotics.
Yeah.
So prebiotic is a raw material on which the gut microbiome is acting, and probiotic would mean the live microorganisms which are given as health supplements. They are called as probiotics. And what are postbiotics? Postbiotics are the byproducts or the things which are being manufactured by the gut microbiome from the raw material, which is prebiotic. And these short chain fatty acids belong to the category of postbiotics. And what do? They are a very good source of energy for your large intestine or colon. And it also tends to counter the inflammatory environment in your intestines. So, I have talked about the gut microbiome and how they are countering the bad ones. So, there is an equilibrium between the good and bad ones. This is called as symbiosis. And once this balance is lost and the bad ones start increasing in number, which is called as dysbiosis, this has been purported as the mechanism by which many conditions like inflammatory bowel disease and fatty liver disease tend to develop. So that's the importance of the gut microbiome.
So people need to know the pre, pro, post, all
Post.
these three things.
Yeah.
So from a normal person's point of view, let's say they don't yet have any serious gut issue or anything. What are the kinds of things they can eat to maybe improve their gut health from a pre? So would it be things like processed ones like Yakult, or would it be more like do you eat fermented foods? And there's a lot of discussion around food and diet and all, right? And there are many influencers talking about many specific diets, right? So I'm sure in my opinion, not one size fits all, and I'm sure you have seen that also as well. But are there any general guidelines, or do you think that everybody is slightly different?
I would say we are lucky to have a rich and varied culture, and there are many good foods which are native to our country. So fermented foods particularly. So the idli, dosa batter that we tend to use, these are fermented overnight, and with that we tend to see growth of good bacteria in them, and also the associated postbiotics, which are the byproducts of these microbes. And similar fermented foods are native to various cultures, like the Gujaratis have the dhokla, and in other countries also there are traditional food items which are fermented, like sauerkraut and kimchi in Korea. So stick to the
Local.
native and traditional diet. That would be my
The
suggestion.
kanji also?
Yes,
Yeah.
yes, certainly. So there's the traditional pakala, which is made by mixing curd and rice, and you keep it overnight, let it ferment. The next day when you consume, it's a good source of probiotic, good bacteria, and this tends to help in improving and making your gut microbiome better. What is bad? Anything which is processed and ultra processed foods, things which can be stored for a long period, anything which doesn't perish, which comes in cartons, these are all bad for you. Okay, so that's the general rule of thumb, I would say. Anything which comes straight out of the garden, which perishes very quickly, these are all gifts of nature, and they are all good for your health in general, and also for the gut microbiome in particular. So, and try to look for more diversity in your food items. So I would say you need to be taking at least 30 to 40 different kind of food items every week, which is not a hard task if you look
If
at
you
it.
just count, yeah.
Yes, yes.
And different colors.
Yes. So with colors, the natural colors which come straight out of the garden, we are banking on the antioxidants, which are in bountiful quantities in such food items. So capsicum, then all kinds of berries. These are all good sources of antioxidants, and they are the ones which improve your gut microbiome and also your health in general.
And these days, I think a lot of discussion is around stress and sleep. Right? And I know you mentioned the gut-brain axis, but how does sleep, impact that? How does does that change your gut microbiome, or how does this actually work? I know that it works, but how does what is the mechanism underneath that is causing it?
So earlier days we used to say that 6 hours sleep is good enough, but of late we have realized that one size doesn't fit all. People have their specific sleep requirements, but a person should be getting at least 7 to 8 hours of sleep in a 24 hours duration. And how does it affect the digestive system? It certainly has an effect on the gut microbiome. The other aspect is with stress, the intestine cells, which are tightly bound together and which are acting as a wall and preventing the harmful germs from entering your blood circulation or into your body, this defense mechanism gets affected. With stress, lack of sleep, the gap junctions between the intestines, they are affected, and we tend to develop a situation called as leaky gut in crude terms. So all the microbes and harmful toxins, chemicals which are there in your intestines, they can enter into your blood circulation, leading to various kinds of conditions like inflammatory bowel disease, and we have already talked about fatty liver. Yeah.
So you had also mentioned that H. pylori is fairly common in India, but how do they actually get, where is the source of that? Do we all have some H. pylori that suddenly increases in numbers, or is it food? Or is it multiple sources of?
So H. pylori is transmitted from person to person through a mode of transmission called as fecal-oral. So an infected person tends to shed the bacteria in his stool, and say for some reason this fecal material contaminates your food and water sources, the bacterium again enters your stomach. And the unique thing about H. pylori is it tends to affect only your stomach. It doesn't have the ability to affect any other body organ. And what is the problem with H. pylori? Is it that each and every person who has H. pylori should have a very bad form of ulcer or a bad form of acid peptic disease? That's not the thing here. We need to understand, example, during the COVID pandemic, the first and second waves, we saw that the virus was very dangerous and it was causing all kinds of problems. Hospitalization rates were very high. The same holds good for H. pylori. But when we came to the third wave of COVID, it was a very mild form. So even in H. pylori, there are pathogenic strains which lead to bad form of the disease, leading to ulcer formation. And there are harmless strains which don't cause ulcers. So if you look at the data, we see that in India, around 20 to 30% of the population tend to have H. pylori in their stomach. But it doesn't mean that we need to look for all these 20 to 30% of people and we need to give an antibiotic course for all of them. That's not the thing here. We need to look at people who are having symptoms like STD, gas-related issues. In them we look for H. pylori, and in those situations we tend to treat H. pylori. Otherwise, there's no point chasing H. pylori or treating it. That will be
There are
a
no
futile
symptoms.
and unnecessary job.
And so let's say people have gut issues of various kinds, and you give them medications, right? Have you found any value in like a pharmacogenomics in terms of understanding of the drug dosage or toxicity in any patient, or is that something that still needs much more from a gastroenterology perspective?
Yeah. So pharmacogenomics mean that the genetic profile of one particular person is affecting the effect of medication that he is consuming. So certainly we have seen situations where the pharmacogenomics tend to affect the dosage of the medication and also whether the medication is going to show some effect on the patient. So people have the NUT-T15 gene polymorphisms and also TPMT gene polymorphisms. And in conditions like inflammatory bowel disease, we tend to give medications like azathioprine. And the metabolism of this particular drug is influenced by these gene polymorphisms. And some people may need a very less dosage of the same medication, and some people may need a much higher dosage. And the same holds good when we are trying to treat acidity related issues with proton pump inhibitors. Their metabolism is also affected by the genetic profile of a person. So there are people who rapidly metabolize certain drugs, and in them we may have to choose alternative medications or go for a higher dosage of medication. So yes, pharmacogenomics certainly is here to stay, and we call this as personalized medication. As the science evolves, we can look at the genetic profile of one particular person and realize what medication and at what dosage will be very, very appropriate for him.
I think, I'm really glad to hear that, because clearly we've been working on pharmacogenomics and come up with
Good to hear that.
So you mentioned a little bit of the leaky gut, but was that term actually from the medical world, or was it from the social media world?
So in medical science, there is no proper condition or a disease called as leaky gut. This is a broad term which is used to describe a condition where the wall which is lining your intestine gets breached and all the harmful chemicals are leaking across. And what are the things which tend to cause this leaky gut? Stress, like we discussed earlier, lack of sleep, and usage of medications like pain medications. Particularly, there's a group of medication called as NSAIDs, which tend to affect the wall of the intestine and lead to this condition called as leaky gut. And also unnecessary usage of antibiotics leads to imbalance between good and bad bacteria, thereby the bad bacteria get a chance to affect the wall and lead to leaky gut.
Absolutely. I think that also points me to the point where when people take antibiotics without a doctor's
prescription,
and then they tend to get a lot of the antibiotic resistance as well.
Yes.
Right? Maybe I think that's
also
a very
diarrhea.
Yeah, that's a huge problem that we see in especially in India, because sometimes you might be able to get access to that. So I think maybe a few words of caution on the.
So we are already bearing the brunt of this indiscriminate and unscrupulous antibiotic usage. Even the most broad spectrum and advanced antibiotics are not working in some situations. There's a enzyme called as New Delhi metalloproteinases has been named looking at the antibiotic resistance by certain bacteria. So these infections tend to go unabated, and even when given and treated with antibiotic in a proper fashion, they don't respond well. And the end result, we all know what are the bad situations we are envisaging. So that's the problem with indiscriminate usage of antibiotic. My suggestion is take them only with a doctor's prescription. The problem in our country is pharmacists tend to dispense antibiotics even without a proper doctor's prescription, which should be checked in due course. And taking the antibiotic for the prescribed duration is again much important. Shorter durations or unnecessarily long durations can both be bad for them.
So when they say you should complete, let's say a doctor prescribes you 5 days, then you should do the 5 days.
Yes,
and not,
yes,
not,
yeah.
not do 3 days.
Not cut short the
yeah.
thing for a shorter duration, because certainly the symptoms tend to get better within a day or two of starting the antibiotic. But that doesn't mean the infection has been completely controlled. And hence the reason we suggest that the antibiotic has to be certainly taken for the prescribed duration.
Absolutely. So, I mean, this is a difficult, a tough question because you're a gastroenterologist, you know everything about the gut. But have you ever faced any challenges yourself with the gut?
Yes, so there are situations where we are not getting enough sleep, days pass altogether without getting good rest. Those situations, those stressful situations can lead to conditions like GERD, and I myself have encountered GERD in some instances. And also, there is a direct relation between acid reflux and weight being on the higher side. As the weight starts increasing, the chances of someone developing GERD also tend to go up. So I have seen situations where once my weight starts increasing, say by a few kilograms, then the tendency to develop acid reflux always tends to crop up. So, and how did I rectify these problems? By looking at the root cause. Say my food and dietary choices have been wrong, I try to correct them. Then try to get adequate sleep, avoid stressful situations, and also keep your weight in check. That's another important thing.
And since everybody seems to be talking about the GLP-1 drugs,
Yes.
And they said they had some effect on the gut as well. Of course, clearly on the obesity part and the diabetes. But there's also an indiscriminate use of that as well. So do you think that people should be a little bit more cautious about using some of these drugs, or do you think that a lot of the studies are showing absolutely fantastic results for any disease or anything, right? What are the challenges in something like this, which is still fairly new, I would say?
That's a excellent question that you have asked. So we call GLP-1 agonists as a game changer, in the sense that obesity has become epidemic when we talk about developing countries like India. And despite the best of measures from the patients through diet control and exercise, we find it difficult to keep the weight under check or achieve good amount of weight loss. And with obesity there comes a plethora of problems like obstructive sleep apnea, then fatty liver disease. There are certain cancers which are more common in obese people like esophageal, colon, pancreatic, breast cancer, uterine cancer. So obesity is not a single disease anymore. There is a plethora of problems which tend to come up with obesity. So all the while we have been looking at options to control obesity. And what were the options? Bank upon diet control and lifestyle measures. And if it is not working and the BMI is way higher, then there was the option of bariatric surgery. But a middle path was missing, something which was not as aggressive as a bariatric surgery, and something which was a step above the diet and lifestyle changes. So in those situations came the GLP-1 agonist, Caution is certainly needed in taking these medications. Always have to be taken with the doctor's prescription. Reason being, they also come with their uh, baggage of side effects. Some people can have inflammation of the pancreas, which again is a rare thing. Some people can have thyroid related issues, and but the common side effects tend to be bowel related changes with constipation, diarrhea. Most people also have reduced appetite. Some people can have vomiting. So there are side effects related to GLP-1 agonists also. People who have diabetes say they are taking the medication without a proper prescription, they are at risk of developing low sugars. So a caution is certainly needed, but yes, they are a boon when we talk about addressing obesity. And like I said, it's a game changer.
It is. I think the studies show like good things, but they always need to be under medical supervision.
Yes.
So that's the important thing. I guess there's also Lilly is also coming out with a
Lilly has
oral tablet as well. So I guess that might make it even more interesting from availability or accessibility point of view as well.
the oral medication was available for past 2 years or so. Now they have come up with a once weekly injectable preparation, which is very convenient, and we are seeing good amounts of weight loss even with the initial dosages of these medications.
So we touched upon the gut microbiome and the pharmacogenomics. There is also, and since you mentioned colorectal cancer and a few other things in our conversation,
Yeah.
I think one more thing is to understand the genetic predisposition for a lot of that early enough to be able to make those lifestyle changes early. Do you think we'll get to a point where people are much more aware and come to you earlier rather than later of the disease, or that is still not happened from a medical perspective?
So we are living in some very exciting times. There are things called as liquid biopsy. You take a blood sample and the circulating DNA from the cancer or tumor can be picked up in this blood sample. And so it gives us a scope to diagnose the condition very, very early. And this is a less invasive modality. Now, whenever we want to diagnose colorectal cancer or things called as colonic polyps, we are banking upon colonoscopy, which again is a tedious process, and people have their reservations about getting a colonoscopy done. So, if we have less invasive measure like a blood test which can tell us about the risk of having colorectal cancer, yeah, certainly on any particular day I would take it with both my hands.
So we'll move on to things because the gut always has a lot of myths attached to it. So we'll move to a short section which is just about myths and facts. Is it true that spicy food causes ulcer?
Spicy food in itself doesn't have the ability to cause ulcers. It is H. pylori like we discussed earlier. But once a person has the problem, say he has erosions in his stomach because of H. pylori, or he has an ulcer in the stomach because of H. pylori, in those situations when they consume spicy food, they tend to experience more discomfort. Otherwise, spicy food per se doesn't have the ability to cause ulcer formation.
And if you don't have symptoms, your gut is perfectly healthy?
There are many conditions which don't create any symptoms. Fatty liver is a best example for that. But is there a problem with that? Yes, certainly there is a problem with that. And there are conditions like celiac disease, H. pylori infection also in some situations may start in the asymptomatic phase and go on to create issues with ulcers. And colon cancers also. In the very early stages, a person doesn't have any symptoms. But we always need to look for red flags and be wary of them. That's the way of identifying these problems early. And yes, the statement that asymptomatic means you are totally healthy doesn't hold good, at least from GI perspective.
Yeah, absolutely. I think we find many people with a lot of gut dysbiosis even though they haven't mentioned that. And then after we send them the report, then they'll be like, yeah, that's true. Then they remember some of the symptoms as well. So another thing is probiotics, right? Like now, do you think that they should be like all of them are the same, or should they be taken personalized, and should everybody pop up probiotic every day?
Probiotic as a regular thing, I wouldn't recommend that. Are all probiotics the same? No, the statement is false again. There are some particular strains, and in most studies it has been seen that a combination of few strains at a particular dosage is doing the trick for that particular disease. So all probiotics are not the same. And should you be taking a probiotic on a regular basis? I would bank on taking more prebiotics, which are undigestible fiber, something like onions, leeks, and raw bananas, psyllium husk, and brinjal. These are all good.
I didn't know about the raw banana part.
Yeah. So these are all good prebiotics. They act as raw materials for the good bacteria, and fermented foods again. They are a combination of both probiotics and postbiotics. So that again is a very good thing to bank upon rather than taking probiotics alone as a health supplement.
Absolutely. Okay, next one is genetics doesn't play a role in digestive issues.
There are many conditions where genetics tend to play a role. Inflammatory bowel disease, for example, tends to run in families. Celiac disease, so you have genetic predilection to that. Whenever we identify a patient with celiac disease, we also tend to screen the first degree relatives for the celiac disease. Reason being, it has got a strong genetic predilection. There are HLA DQ2 and DQ8 polymorphisms which tend to cause celiac disease. Again, there are familial polyposis syndromes which cause colon cancers like FAP, Lynch syndrome, to quote a few.
Absolutely, I think there are a lot of them that are there. I know that the recommendations say that over 50 you should get a colonoscopy, but the statement is you need a colonoscopy if you only need a colonoscopy if you have symptoms.
In the Western world, this is a mandatory thing. Anyone who is above 50 years, now it has been reduced to 45 years. So there's a lot of data to suggest that getting a colonoscopy done after 50 years should be made a mandatory thing. It is one of those screening modalities where definitely a survival benefit and an ability to diagnose the cancer early has been confirmed. Would it hold good in the Indian context? Now, I would want to quote our study from Continental Hospital where we have done colonoscopy for around 3,500 subjects over a period of 3 to 4 years. And we have seen that the polyp detection rates or the polyp presence rates, polyps are the precursors which go on to develop cancer in around 10% of situation. So we have seen that the polyp detection rates or polyp presence rates are almost 20%. And in the Western scenario, it is said 25 to 30% is the adenoma detection rates. So we are not lagging far behind. And yes, I would say, would I recommend a screening colonoscopy for someone who is above 50 years? I tend to give them the option of getting a colonoscopy done. I present them with the data available and I leave it to their choice. But as the data evolves on this interesting topic, I would suggest that screening colonoscopy may become mandatory in the days to come.
Hopefully they'll make it procedure a little bit simpler. I heard it's already become simpler. Relatively.
In the hands of experienced people like me, it's not going to be a nightmare. It's going to be a comfortable procedure.
So I remember the time when my daughter did the endoscopy, and it was quite funny because I think they put the anesthesia, and I think you do that for the colonoscopy also.
Yes, yes.
She was laughing and she's like, "No, you didn't do the procedure yet." And I said, "No, it's done." So I think people should realize that you'll be under anesthesia, you probably won't
So
know
with
what
anesthesia, it's as comfortable as it can be. You won't have any recollection of the thing. It's like going to sleep and waking up, and yeah, the procedure is done.
Yeah, I remember that. She just kept arguing with me that no, it's not done. So, okay. The next statement is antibiotics don't affect gut health if taken for a short period.
The statement is false again. Antibiotics can wipe out the whole gut microbiome. All the effort that you have put into building an ideal environment, it may all go for a toss within a day or two. So don't take antibiotic even for a day or two when there is no proper indication.
This one I think you already mentioned. Pharmacogenomics has no role in treating GI
Yes,
conditions.
yes, yeah.
We already discussed that. Okay. If you cook once a day, your gut is healthy.
That would depend on your dietary practices, which are different for each and every country. So as Indians, we tend to consume a lot of fiber. In the Indian context, one bowel movement daily may be seen as normal, whereas in the Western context, 3 to 4 bowel movements in a week is also seen as normal. So what is considered normal for our country may not be normal for a Western country.
Gut microbiome tests are just wellness fads.
So that's a very interesting thing, and I'm happy that we are discussing this thing. So there are multiple labs which have mushroomed and which are offering the gut microbiome as a test. We have data in our hands, but the problem is we don't know how to tweak the gut microbiome. And is there any way we are able to increase the number of good bacteria and reduce the number of bad bacteria? We are again falling back to the time-tested strategies like taking diversity in your food, going for natural items, avoiding antibiotics, avoiding indiscriminate antacid usage. So these are the measures that you are falling upon. So you have data which leads to unnecessary panic, and that's the problem with a gut microbiome test.
There is also information that can be gotten about antibiotic resistance, pathogenic bacteria, and others. I think those can be helpful from a treatment perspective. But I guess it depends on who's using it. Right?
Yes.
If it's used in conjunction with your other tests, I think it becomes valuable. If it is done just by an individual, then I think they get information about mood, energy, and also things like your dysbiosis and others. But hopefully, then they come to see a gastroenterologist.
Yes.
Right? That's the thing that I think it's not about popping a pill. It's more about, can we get people to understand that something is off, and can they meet a doctor?
It's need to arise to the problem and take cognizance of the problem and address it accordingly.
So now we'll come to the last segment, which is the rapid fire or the fun part.
Okay. I'm up for it.
Okay. So if you weren't a gastroenterologist, what would you be doing today?
If I had been any more taller, I would have walked the ramp. That's one thing.
You can still walk the ramp.
I would have been a rock star.
Yeah.
Now I understand that the people also need to make you a rock star. It's not only about starting a rock band. But on a serious note, I may have pursued an MBA from a reputed institute, and may have turned into an investment banker.
That's nice. So I think you're doing something much more interesting.
Yes,
Yeah.
yes.
Yeah. If your life had a theme song, what would it be?
Theme song, I would say the Jo Jeeta Wahi Sikandar, the title song. That would suit me very aptly.
That sounds like a lovely, lovely.
Yeah. So growing up, 92.
You sing songs also?
No. I would want to spare the audience from the horror of that.
I'm sure this is. I know. I'm assuming I know what you'll answer. Did you ever get a patient who diagnosed themselves on Google and came in terrified?
Happens quite often, very often. If we see 100 people, I would say 20 to 30 of them are disturbed by the knowledge that Google is offering. Most of them, they already have diagnosed their condition, and they have come to check whether the doctor is also telling the same wisdom. So that it happens quite often. But believe me, the reason why we haven't found a substitute for a doctor even in the age of artificial intelligence is like we started in the very beginning, medicine is an art, and you need to take into consideration a number of things, and there are a lot of things which even we don't understand, and the human body is a wonderful thing. Many things are in the phase of we are in the phase of understanding how they happen. So at the end of the day, believe in what your doctor has to say and has to tell about your health problem, and Google can certainly help, but assuming that it's going to be a savior in all the situations may not be the right way of looking at it.
So now do you see the transition between ChatGPT and now Gemini and Chat?
Yes, Grok.
So yeah, Grok. Okay, Grok also.
Yes.
So that's. So what is more dangerous to the gut, junk food or toxic WhatsApp health advice?
That's a bouncer, yeah. So I would say both. Junk food, for obvious reasons, it's harmful, and harmful WhatsApp advice again, yeah, can be detrimental. We tend to see this thing very commonly. When we have a conversation over the phone or SMS and try to understand the gravity of the problem, we always fall short of the actual situation. What looks like a very mild problem may be a life-threatening scenario in reality, and the opposite is also true. What it is looks like a life-threatening problem may be a very mild problem in reality. So I always tell my patients to meet the local doctor, even if they are not a gastroenterologist, even if they are not a general physician. A doctor who has done MBBS can also do justice to their problem, because they will be examining them, they understand the severity of the problem, and they will be able to diagnose the situation in most of the cases. So meeting a local doctor is more important and carries more worth than a WhatsApp advice.
Yeah, I think that has become quite a bit of a challenge. Which is worse, constipation or diarrhea? I thought I'd end with that.
Would depend on your profession, I would say. So if you are actively moving, you are someone who is going places, then diarrhea may be your bane, I would say. Then, but for people who are experiencing bloating and abdominal pain, for them constipation tends to be very bad.
Absolutely. So I think, with the gut, I think we can probably continue for a long time, but thank you so much. And if there is anything that you want to tell that I haven't covered, maybe.
Thank you once again for having me here, and it was a quite interesting chat. We covered a lot of things, the scientific aspect of it and the fun part as well. And Yeah, like I said, take care of your health. At the end of the day, it's the only thing which is of importance. And once you introspect, you realize that's the correct thing. Thank you.
Thank you.